Done our skin analysis and we already have taken some pictures.
Yes.
So I'm going to go over that with you. But first of all, I want to ask you, what's your concern? And congratulations, by the way, to getting married. So you are getting married in
November 2nd.
November 2nd. So we have a couple of months in hand today.
Yes.
So let's start. If you look in the mirror, what you see and what we kind of want to improve.
Well, I mean, these have always been a major problem of mine since I was a child. So filler for that would be great.
Okay.
And then maybe just fill my lips a little bit just so that they're more like they used to be when I was younger.
Sure.
And then obviously the tone of my skin. So like, you know, I've got a lot of red and brown spots from living in Florida. And, you know, just getting refreshed and younger. Like I'm getting to be closer to 40. So anything we could do now to slow that down would be great.
So basically, we're going to get you ready for your wedding. You're going to look great in your pictures. So we're going to go do your skin analysis and we're going to have a plan for you.
Yes.
So whoever is kind of looking to get married, what we can do and to kind of perk up the face. So you have, you know, more confident, you look great and enjoy your wedding. And because the pictures are forever, especially, you know, after a wedding. So I'm going to just go over my Visual skin analysis. So Visual is a kind of a great tool to analyze your skin, and basically when you're doing for the first time. So it is 8 different parameters which it kind of takes account of, and then it's comparing it with your skin type or your age and where we see where we stand. And if you're doing some procedures, some lasers, some hydrofacial or chemical peels, then we can come back after a couple of months and compare where we stand, how much we improved and everything. All right, here we go. So since we are opening it up through mirror, this little mask and these little dots you can see here. So right now it is just showing the visible spots what you can see on your skin overall. And then there's a different areas we can go and analyze. So see how the wrinkles is showing that we are getting some wrinkles in between the eyebrows, some in the forehead, more around the eye. It picks up on the lateral view, so it is not analyzing anything around your eye right now. But just looking at your skin right now, we can see that we are starting to have some expression wrinkles. The expression wrinkles mainly happens in 3 places. Around the eyes, the forehead, and we call it crow's feet. So when we are talking about the expression wrinkles, these are caused by our muscles of expression. So these are our muscles of expression, and our skin is attached to them directly. And when we are dragging our skin for so many years, that start causing these lines. So first the lines just come during the expression, and then they become deep and deep, and then they start having on the rest too. So you can imagine like lifting your eyebrows up, like dragging our skin, and in that motion to causing lines here. And this is a big round muscle around our eye, and then when we kind of smile or squint, that causing lines here. So the lines always happens perpendicular to the muscle. And next thing we're going to talk about are visible changes in our skin. So visible changes in our skin is happening. You can see some broken capillaries right here, the red spots, some sun damage going on in form of brown spots, skin irregularity. There's some you know, the sunburn spot, which called actinic keratosis, coming up here, and some volume loss we can see a little bit here going on and around the eyes. Let's go to our next parameter, looking at the texture. So again, texture, the percentage we can see in more when we go in Visya, but here we can see it's picking up the elevations and the depressions in that one. Pores, UV image, and UV spots is where we see the sun damage. So before we saw the visible spots on the skin, and then you're seeing way more underneath the skin that over the years they will come to the surface. And there's some pigmentation change you can see on your upper lip too, but here it's all picking up. We can take this mask off and we can see even clearly what's going on underneath our skin. And we see the red areas. So there are some red areas we can see on the top of the skin, but underneath the skin we can see how much inflammation is going on and where we need to target with a little bit more energy when we are doing other laser treatment like BBL on the cheeks and the nose. So that's the kind of my main thing. Porphyrins is just to see how oily somebody's skin is. Not working here. So it's just the count of bacteria, oil glands, oil skin. Any questions? Anything so far?
No. I mean, I think that's perfect. I mean, I know that this area, actually, when I was younger, I got a really bad sunburn on, and my nose was bright red for a year.
Yeah.
so it's so funny that it's still under the skin, like hanging out there.
That's a kind of thing how our pre-cancer, so we call it actinic keratosis, develops. So this is the result of sunburns happens years back.
Yeah.
So 99% of our cell can repair itself, but some of them can't. And this abnormal mitosis or abnormal cell turnover, and they're just dividing abnormally more than what we want to. So they develop with a red base and that white crust on that. So that's, and it doesn't heal. You can peel that off, but it always comes back.
Yeah.
So that's the result of the sun damage. So it's really important to wear sunscreen under our makeup every day.
Definitely started wearing sunscreen.
That's good. That's good. Sunscreen is the best anti-aging. Yeah. So we're just going to. I was just going over that. I'm going to pull up our Vectra next. So Vectra is a 3D or three-dimensional technology. What it does, this software, it takes 3 different pictures and combine it together to make it more realistic image. And it kind of, when we are doing volume. Or taking volume from Kyber light, you can have a better assessment with that.
Yeah.
So I'm going to just pull up your picture with that, and then we're going to go over the plan. So as we are addressing something like something overall skin, in form of red and brown, the pores, the elasticity, how we improve that, number 1. Number 2, how we improve our lines of expression or wrinkles of expression. And number 3, the volume around the eyes and the cheeks and the lips. So that's kind of a summarize our face rejuvenation in shell. So we're going to go in detail in that. So this is our picture, and then you can see how it is 3-dimensional. We can see a better view of the volume loss more pronouncedly right here, around side, and to see the symmetry, like you can see around this. Whoever did this picture did a good job. Like I have a very good silhouette of there. So anything we are doing underneath the eyes, we can or even nose, like we do rhinoplasty with filler. So we can see the nose symmetry. If any bump or anything, we can correct. So that's a really good technology. So we can do a different view. And if you're doing, I want to show you the assessment of symmetry. So how it kind of showed that the both sides of her face are never 100% symmetrical, The half sides of face, we always call our sisters, not twins.
Yeah.
And this is you, really. And then what it is doing, it is combining right side of your face together. And this side is combining the left side of your face together.
That sister looks way better than the sister on the left.
So what it's telling me your right side has more volume. So that's why the face is coming like broader. The bone structure, even the volume, so even the lip is coming. That's why it's coming different. And when we go on the left side, it's combining two left side together and telling me that your left side has a little bit less volume. So look at it in real time with this technology, kind of gives it a better view. And and also we have to understand that each treatment going to enhance your look. So it's a kind of a nice and easy, and going to take a couple of sessions to reach there when we call it full correction, especially with the filler, because we can't overfill it and make it look unnatural. If we underfill it or we giving enhancement, and the next session we are going where we want to go, it is more natural progression to our goal. And of course we can always add more, but it's hard to take out or dissolve. And again, like your skin requires some maintenance, like you're going to gym, so you just, for your overall body, you don't go for one day and you're done, you need a maintenance. So when we do something on your skin, we need to maintain with our good skincare products at home, and something with esthetician for nice brightening, exfoliation like chemical peel, some microdermabrasion, and hydrofacial is a great treatment on that. And I'm going to write down a good plan for you. So again, it is showing because this is like a little bit overlap, it also showing the little bit redness and the pigmentation issue too. With you can say in the gray it converts, so we can see volume enhance of venous loss even more pronouncedly, because all the distractions of skin tone and everything are gone now. So that's pretty interesting to have our baseline, and then we're going to go over with the face. And when we're preparing a bride, this is kind of a whole package, the face, which is kind of our 90% most important thing, and then we have to kind of go over the body too. So in the body, we're also preparing for some contouring, right?
Yes, I would like the liposuction with the dermatite. Okay. After I had 2 babies, it's I cannot. It's get rid of the skin and the fat that's under there. It's a spare tire.
Yes, and the liposuction is a good treatment for contouring. It's not for overall weight loss. It does not replace good diet, exercise, but especially after childbirth, there is some stubborn pockets of fat we cannot get rid of, even if we do 1,000 crunches. So that is more genetically and after some conditions like childbirth. So we're definitely going to be happy to address that. And I'm going to go over. So this is our picture where we are going to look at that, and we are going to address the lower abdomen. So we're seeing some, adipose tissue or the fat, some laxity. So we want to address that and give you nice contouring as much as possible. In some people have too much skin and our muscles kind of separate, then the abdominoplasty surgery is required. But if you have just a little bit extra fat here, and like love handles or bra fat, like any stubborn areas where with diet and exercise, no matter how much you do, you cannot get rid of it, then This body contouring is a great
yeah, because I'm
treatment.
happy with my waist size and my overall shape. It's just that little
area.
pocket.
Right. So that makes you a good candidate for that. And again, I want to go over whoever is getting ready because when you were doing liposuction is done under local anesthesia nowadays. So we're just numbing that area we need to work on, and with the very thin cannula, we are taking the fat out. So it's a one and done procedure. In rare cases, you may need some touch up, but we need some time to heal. The best results come 3 to 6 months later.
Yeah.
So right after, you can have some swelling, some bruising. You have to wear the compression garment, and so that's why we had to plan this ahead before.
Yeah. Definitely want to do it right before the wedding.
Yes. So now we addressed all the issues, and now we have to make a plan. And we generally kind of want to write it down and go over that. So squeeze your eyebrows together. So this is a kind of a muscle right here, and we're going to relax this muscle. So you give nice, lift and relaxed look, and raise your eyebrows up. So this is going to be our forehead, and I notice you have like a scar here. When we're going to do the dye sport here, it's going to flatten the scar a little bit. Okay. And kind of laser will help too. So all the skin overall right here, we're going to address with BBL. Give me a big smile. So that's kind of the area we're going to do our dye sport. And this we call it tear trough, and it's more genetic. And when we lose weight or with time, there's a fat pad around our eye and fat pad around our cheek. They tend to get separate, and our vector of volume goes down, and we want it like up like that. So if we kind of do this triangle right here, we're going to address with like cheeks, and we're going to do this area, and we're going to do some enhancement in the lips. So you can see, as I was discussing before, we are not 100% symmetric. So you can see at this side is a little bit higher than this side. We will try to work as best to make it like build this lip a little bit more, give a little bit volume here, and a little bit volume here.
Yeah, it makes it really annoying when I'm trying to do lipstick. I'm like, they're not the same.
Okay. It's a little bit submental fullness, not too bad. Underneath the chin, which I notice in the pictures, but that's we address with something like Kybella. So we kind of do kind of a little bit injection here, which shrinks this area up. Okay, so look in the mirror. I know I put a lot of marks on your face, but what do you think of our plan so far?
I like it.
Okay, so there's a couple of things we can do in one session, or we can do together. So everything for BBL takes 7 to 10 days to heal. The filler, when we're putting, it's a nice gel we're putting underneath the skin, so there can be some swelling and bruising. So you cannot do it, of course, when you're planning a 2-course. So whoever is getting like big event or getting wedding, we need at least 2-3 weeks before. The dye sport is nice product which relaxes the muscles. It is dissolved in salt water. So we use very fine insulin needles with that. So that doesn't have any downtime. So it looks like tiny bite marks or mosquito bites, which goes away within half an hour, and you're ready to go back to your work. So that's why it is so popular. But it takes a couple of days to start working or kicking in, and 2 weeks later, when you have the full result, we want to see you back for the follow-up or the checkup, make sure everything is looking good how it's supposed to. So just I'm going over the dashboard, the filler, which we are going to do the Wrestling family today. Okay. And we're going to do the BBL. Actually, all of that we can do in one sitting. But since your wedding is in November, so we probably will need another treatment of dye sport 2-3 weeks before. So give you the best look.
Perfect.
So we should do it today too, because you've never done it before, so it'll give you an idea to experience it, like how it works, how you get used to it. So
Yeah.
you're not going to be big surprise anything before your wedding.
Sounds good.
Okay?
Yeah. Can't believe it. Like, it's so Oh my god, I got cheeks again. Wow,
That's how amazing her eyes
I'm just trying to get rid of all of this. The little, the fine line wrinkles.